Now I'm assessing Haley's abdomen, noting that the skin on her abdomen, there are no lesions and no rashes. Her abdomen is nice and flat. Her umbilicus is midline. I will start off by auscultating Haley's abdomen in all 4 quadrants, listening with the diaphragm on my stethoscope for bowel tones. And now the upper left quadrant, lower left quadrant, and lower right quadrant. Bowel tones are active and normal. And now using the bell of my stethoscope, I'll be assessing Haley's aorta, renal arteries, okay, good. No bruise heard. I'm going to palpate Haley's abdomen first soft and then a little bit deeper. So we'll start on the right and then move to the upper left and the lower left. Does that hurt at all? Tickles? Mm-hmm. And then the lower right. And then a little bit deeper. This is where her liver and gallbladder are. Over the epigastric area, the transverse colon. Upper left, the pancreas and the spleen. Lower left, the descending colon. And then the lower right, the appendix and the cecum. And I don't feel any hepatosplenomegaly. There's no lumps or bumps. Her abdomen feels within normal limits. Moving down to Haley's legs, I'm going to assess Haley's range of motion. I'll start with her right leg, moving it all the way, checking her hip range of motion all the way up to 90 degrees. And she's got good range of motion there. Now bending your knee and bringing it inward to 120 degrees. She has good range of motion with her knees. And then I'm going to have you push against my hand, push towards yourself, against my hand again. Now push your foot up and push your foot down. So her legs are nice and strong, her knees are nice and strong. Go ahead and relax. And then same with this leg, 90 degrees, bend, 120 degrees, push against my hand, push against my hand, push up against my hand, push down against my hand, and relax your leg. Now checking sensation on Haley, both medial and lateral sensation. Can you feel me touching? Can you feel me touching? Can you feel me touching? And can you feel me touching? Okay. Plantar and dorsal flexion. Go ahead and point your toes up towards your forehead, all the way up. Push against my hands now, all the way down. And then checking pedal pulses. Posterior tibial pulses. Both pulses are nice and strong and 2+. Checking cap refill on each great toe, which is less than 2 seconds. And then, can you feel me touching your toes? Good. And then, can you just kind of move your ankles in a circular motion for me? Now I'll be checking the Babinski reflex on Haley's foot. I'm just going to run the key up the bottom of her foot and her toes should curl a little bit. Okay? And that is a normal finding. Now Haley, I'm going to have you go ahead and sit up. Checking her range of motion of her shoulders. Go ahead and raise your arms above your head and bring your arms back down. Move them in a circular motion like this. And then just bring them up like this. And then checking the strength. Push up against my hands. Push down against my hands. And relax your arms to your sides. Now checking her elbows. I'm going to have you flex your elbow. And then extend it. And then flex your elbow on this side. And then extend it. Now do it again against resistance. Up. And then down. And then up. And then down. Okay, nice and strong. Good. Checking Haley's sensation in both of her arms. Can you feel me touching? Can you feel me touching? Mm-hmm. Good. Checking her ulnar and radial pulses. Radial. Now ulnar pulse. Radial. And ulnar. Both are 2+, nice and strong. And equal bilaterally. And checking the cap refill in her fingers. Okay. Less than 2 seconds, nice and brisk. I'm going to have you grip my fingers. Okay, nice and strong. And then I'm going to have you hold your fingers apart like this. And I'm going to try to pull them together. push against me. Haley's fingers are nice and strong. Next, I'm going to check the patellar reflex on Haley, and I will just use my stethoscope for that. I'm going to have you sit back a little bit till your legs hang off of the couch, so bring your butt back, okay? And just on the patellar tendon there, just going to push, and that's normal, and patellar reflex is normal. And now I will be checking her Achilles tendon reflex, and she should plantar flex when I hit the back of her foot, and she does, and that's normal. And she does, that's normal. Haley, I'm going to go ahead and have you stand up now. And I want you to just kind of bend forward for me. Actually, I'm going to have you turn this way and bend forward for me slowly. Just checking her, go all the way down like you're touching your toes, checking the alignment of her spine, which is nice and straight. No lateral curvature of her spine. No kyphosis or lordosis is noted. Haley, go ahead and stand up. Now I'm going to assess Haley's gait. Haley, go ahead and walk forward for me. And then when you turn around and come back to me and walk heel to toe. Go try that again, heel to toe. Okay, and then I'm going to have you walk on your tiptoes. And then I'm going to have you walk on your heels. And then I'm going to have you come back. Her gait is normal. And then I'm going to have you put your arms out and close your eyes. And I'm going to touch one of your fingers, and with that finger I want you to touch your nose. And this is the Romberg test. Good. And go ahead and touch your nose with that finger. Okay, and Haley's proprioception is with the normal limits. That is my assessment. I hope you enjoyed it. Thank you. I forgot to touch